Hello everyone and welcome back to another episode of Behind the Smile. Joining me in the studio today is Dr. Julia Nicholls. Julia is a clinical psychologist with over a decade of experience working in both public and private settings. She works across clinical practice, education and research and is passionate about destigmatizing mental illness, particularly psychosis, and supporting mental health of new and expecting parents. Julia is currently co-writing a memoir with her husband about their shared experience of postnatal mental illness after the birth of their first child. Now, this is a big conversation and it carries a huge amount of stigma, so I am incredibly grateful to have Dr. Julia here on the podcast today. Julia, welcome to Behind the Smile. How are you today?
I'm good. Thank you for having me, Ash.
I'm very, very excited for this conversation. I feel like this is a conversation that I personally haven't really had with anyone before, and I think that it's going to help a lot of people. So from the bottom of my heart, thank you for being here.
Well, I hope it can be helpful to even if just one person, but to more people, that would be great.
I feel like it might be. I've got a sneaking suspicion. So I want to kick things off just allowing our audience to get to know you a little bit better. Can we start with where do you live? What does an average day look like? And what do you do for fun?
Okay. So I live in Melbourne, Australia. I've been here for most of my life with a couple of stints elsewhere. Average day, it depends on the day of the week. I work 4 days a week as a clinical psychologist. So some days are busy seeing clients. I do a lot of supervision of other psychologists as well. And on my days where I'm not at work, I'm looking after my 2 daughters with my husband, of course, and we like to go to new parks and try and find if there's something exciting we haven't seen before.
I love that. I love that you have that really beautiful blend of being able to do what you love professionally, but then still have that time with your family. I was asking you before we started recording if you had studied psychology straight out of school, because I always think it's a really interesting one. Often I meet psychologists and there's always been some sort of something that's happened, and it's almost like a yearning to want to understand themselves more that leads them down that path. But you kind of came through an arts degree, didn't you?
Yes, it's very interesting. Often we talk about that as psychologists as well. And for me, it felt very like it happened over time. So it was one of the subjects I did really well at school. Didn't really know what I wanted to do when I was going into uni. I took a gap year off, which I mentioned to you, and I did the Bachelor of Arts and just tried loads of different things, and I still really liked psychology. Now that I know myself better, maybe there was something in there that I was interested and curious about, and maybe understanding myself, other people. But at the time, it felt just very much like that was kind of the subjects I really, really enjoyed and found interesting.
And tell me, being a psychologist, does that bring up a constant self-inquiry? Like is doing the work with others almost bringing a mirror back to yourself?
It's very, very important for us to have reflective practice. It's actually, we're having a change in our competencies as well as psychologists at the end of this year, which goes across the entire country. And we have to have what's called reflective and reflexive practice, which is about that ability to notice our thoughts, our feelings, what's showing up for us in relation to the people that we're seeing, because we need to be objective. We need to not be bringing our own challenges to that space. And we also have what's called clinical supervision for our entire career. It's mandated. So from being a junior psychologist where you see a more senior psychologist all the time about your cases, to being more senior and experienced, you still have quite regular supervision as well to I guess explore the work you're doing, not only the evidence base but also what the impact of the work on you as well.
Yeah, that's what I was thinking about as you were talking. It must be a huge weight to carry in many senses, even just energetically of holding space for people day in and day out, multiple clients in a day, and people are bringing their stuff, the heavy stuff, the life stuff. And so being able to still look after yourself and have those boundaries around your own energy while being able to provide a service. And like you said, an unbiased one, which is something I hadn't even really thought about before, being able to offer that advice from a really neutral standpoint, irrespective of what's going on in your own life, must be so, so important. And, something that we're going to touch on a little later today is the mental health of our mental health practitioners and how important it is to protect that, and the stigma around potentially having an issue, and how difficult it might be for somebody who is a mental health practitioner to say, hang on, I need help, and the stigma that could have on your career. And we will dive there a little later. But Julia, I've asked you to bring in a photo today.
Yes.
And this photo is from a time in your life where you were hiding behind a smile. So you were presenting one version of yourself externally to the outside world, but internally you were really struggling. Could you please describe for our audience the photo that I'm bringing up on the screen now? What are we looking at here, and what was actually going on for you at that time in your life?
I actually think I look really great in this photo.
It's always good when your BTS photo is actually a good photo. So many people, it's like a shocker. I got to say, mine's horrible.
You would really think that things were going really well, actually. And anyway, so what's going on in this photo? This was in April of 2021. And my husband and I are standing together smiling for a photo, and he's holding our 6-month-old daughter, who was our first child. And I've got a big smile. I'm wearing a nice blue dress that I'd purchased for the occasion. I'd had my hair done. I think looks like I've definitely had some fake tan on there. And yeah, even our little 6-month-old daughter is smiling. And it looks like a great family shot. People have asked me if it was a professionally done one before. But I was not doing well.
So on the outside looking in, it's all put together, but what was the reality of what was going on for you?
So we were actually heading to a wedding, and my parents were looking after our daughter for the night. So we'd actually flown to Queensland for the wedding. It was between lockdowns. It was all during COVID, and and your doggy wants to have a cuddle.
Frank has decided to jump on Dr. Julia Nicolls. I'm so sorry. Frank, we spoke about
he wanted to support me while I was
personal space. He does. He gets the sense. He's like, oh, this is the hard part. I'm here. Please feel free to remove him at any point.
So I want to say I definitely had been diagnosed with postnatal depression by this point. I was on medication that I really wasn't very happy with. I had been diagnosed in January. This was in April. And I unfortunately was not someone who was responding very well to medication at the time. I had I think I was on my second trial of medication at this stage. And I had incredible anxiety and insomnia. And I was also in the process, I hadn't been diagnosed with psychosis yet. It hadn't progressed, but it was very close. I was unable to sleep. I was very preoccupied with how much of a bad mother I was, and that my husband was going to leave me. So I put the outfit on, put the smile on, went to the wedding. My breast milk had dried up. I was very upset about that, probably because of my lack of sleep and my anxiety. And so my daughter was on formula, and I remember rocking up to the wedding, talking to somebody I'd never met, and they were asking how I'd managed to leave my daughter. Didn't I need to breastfeed? And I mentioned that I remember I mentioned, my milk dried up, actually, she's on formula. And she was like, oh, that's strange. And I remember, because I wasn't in a great way, that was
shame.
I was really, really upset about it. So I drank a lot of alcohol at the wedding. And as happens, I felt better for a short while, and then the next morning I'd barely slept again, and I was in an even worse place than I was when this photo was taken.
Oh my goodness.
Yeah.
Thank you so much for bringing in this photo, because I think, what you've just shared just now is something that a lot of people don't talk about. And, everybody knows who listens to this podcast, I don't have children, but I have all of my girlfriends have got children, multiple children, and I've seen just how hard early motherhood appears to be. And that's for somebody who's not grappling with a mental illness. To then, even the sleeplessness, which I was just chatting with someone about this the other day. I mean, there's a reason why that's a torture tool.
Yep.
So you remove sleep, then you add in a crying baby who can't communicate their needs. Anybody would have those sorts of thoughts of, I must be doing this wrong. It's your first baby as well, so there's that added into the mix. I can imagine it must have been incredibly difficult for you to draw the line between this is just early motherhood and, oh, no, this is not normal. I need some help here. Like, where was that within your own mind? And then obviously you've got the clinical lens on top of that as well.
I think you're very correct. I think it's hard. It's a big adjustment for anyone. But I think that the thing that stood out to me that there was something really wrong was when I stopped sleeping, because it wasn't a little bit of insomnia. It was like, for months I slept for 3 hours at night, and my daughter slept really well. So I was the one who, if I would have gone to mother's group without postnatal depression, I would have been like, she only wakes up once a night and goes straight back to sleep, and they would have all really been angry at me.
But me, on the other hand.
Yeah, she was always settled. She didn't have any colic. She was quite a happy baby, didn't cry a lot. So she only woke up the once per night. So it was about 8 weeks postpartum when that started. There would have been signs beforehand. My husband, you'd have to do a separate interview with him. And certainly I believe I probably would have had antenatal anxiety that was probably not picked up, understandably, because of COVID, because we were all anxious. We didn't know about the impacts on our babies. We didn't know, there was, TV ads saying, you could get really sick if you get this, and it was really scary. So it was hard to know. I think I didn't really pick up that was maybe antenatal anxiety, and it was a bit more intense. And after the baby was born, I had probably what you would consider a much more intense baby blues. It was probably more of a sign that it was going to develop into the postnatal depression. But I certainly said, oh no, this is just everyone struggles in early motherhood. And my husband was sort of just waiting and a bit curious about that. And at that 8-week mark was when, when the sleep didn't come back again, that's when we knew something was not going well.
And I can only imagine that the inner critic would be having a field day. It's almost like the perfect concoction of all of these things: uncertainty, anxiety, fear, lack of sleep. And then there's that voice that's like, you should be doing better. Maybe you're just a bad mother, or even you shouldn't be feeling like this. Get it together. Were those the sorts of stories from an internal dialogue standpoint?
It's interesting. The ones I remember are very much, I'm sure that there was many more than I can remember. I remember being very preoccupied early on that I was a bad mother, and there wasn't really objective evidence for that. I mean, a lot of women worry that they are. I mean, my daughter was sleeping, she was happy, but I felt like everything I did, and I think because of how I felt inside, it's like, well, I must be bad, I'm not cut out for this. And then because I was changing and I didn't feel like myself, I then was fearful that my husband would leave me also, which they're what we would consider depressogenic sort of cognitions or thoughts that are kind of consistent with the depression. So like a depressed mood, has a lot of depressed themes. So one of the things, though, I suppose I notice in myself, and now I've done a bit of study in perinatal mental health conditions, is I'm quite perfectionistic, and perfectionism is a risk factor for development of perinatal mental health conditions. So I think that's where some of these, a lot of these thoughts came from as well. It's like, well, I've always been able to, get things right, but why can't I get this right? So if there was anything, if she didn't sleep when I expected that she should, or I couldn't settle her myself and I needed help from my husband, all of those seemed like big failures that I wasn't getting it right. And of course, in early motherhood, when you're learning this brand new thing and having this huge life change, you're not going to get it all right. You're learning something brand new for the first time. Nothing that any book will teach you, because every baby is different. But certainly that, I think, contributed to what was going on for me.
Another thought that just came to mind as you were sharing that, Julia, was, with depression, I've had bouts of depression in my life, and at one stage I was medicated for anxiety. And even just recently I had a couple of days where it was like the clouds rolled in, and I can't describe it as any other emotion other than heavy. Like everything just feels heavy. And for me now, I don't spiral because I know that it's going to move through me, and it never really lasts for too long. But back in the day when that happened, it was terrifying because it feels like it's never going to end. Is that the same with postnatal?
Yes. Well, I can speak for myself, but many women are very fearful that this, like, you've given birth to this child, or if you're pregnant, like you're pregnant and this is now your new permanent state. So it can become a fear that's it's not going to end.
Yeah, it would be terrifying. And then having to still show up every day because there's this little human that needs you. must feel like you're almost being torn apart.
I had to, behind the smile again, I had to put on a smile every day, and especially when I was looking after her, because I was very concerned about impacting her negatively. And I'm a psychologist, and I was thinking about, this is what we ask people about, like what was it like? Is there a family history of mental illness? Which is now something, of course, I'm not concerned about, because I know that many of us will have a family history of something, of something there. But I really had to try, and I looked at her and I smiled and I made eye contact and all the things that I knew that were important above and beyond feeding and sleep. But then when she would go down for her sleeps is when I would sort of allow myself to be fully, as I was struggling, and my husband bore witness to that.
Yeah, it must be really challenging knowing how much in that instance.
Yeah, I don't know. People often say to me, did it help? I'm like, I don't know. Yeah, I don't know, because I also tried to control a lot of things because I thought I knew, which is true, I do know, but not when I'm not well.
Exactly right. You can't fix, and I'm not suggesting your brain was broken, but I remember hearing Osher Ginsberg talk about this. He talks openly about having very complex mental health issues, and he says you can't fix a broken brain with a broken brain. We need to bring in the team here and get that support, to get back to wellness. So you mentioned that you were medicated, but you weren't responding well. Is that right? Tell me more about that.
So I was put on medication. I tried a lot of sleep medications that were safe in breastfeeding from that 8-week mark. Well, shortly after, because I became very distressed about my sleep. I knew I should be able to sleep, but I couldn't sleep. And that, to me, that was the key that unlocked everything else. If I could sleep, everything would go back to normal. That was what I believed. So my GPs, I tried a couple of different sleep medications that are okay to try. Nothing worked. And then when I saw the psychiatrist, which was in the January, so about the 3-month mark, I received the postnatal depression diagnosis. I was trialled on medication straight away, which are pretty commonly used for postnatal depression, postnatal anxiety, and I had a lot of problems with side effects from the get-go with different antidepressants and antipsychotics.
And so I imagine that in a way would just exacerbate that sense of hopelessness, right?
Well, for me, it was very much, you try something else and you hope that's it, and you might have side effects from that, and if you get side effects again. For me, it was a bit of a cycle, and I must admit I was not receptive to medication, even though I would certainly encourage someone in my position to work with the treating team. I didn't want to try it, but I did, I did, and I definitely had a sense of the psychiatrist I was working with at the time definitely wanted me to be better. Like, he's a good psychiatrist, but we definitely didn't have what I would call a strong working alliance, and I didn't feel very listened to when I reported side effects, which I don't think was helpful for our relationship, but they certainly affected me a lot.
What would you say to somebody who is in that sort of position where maybe they don't feel like they're, for lack of a better phrase, gelling with their medical team or their psychiatrist? Would you suggest going and trying to find someone else where you felt like there was more of a cohesive working relationship?
It's a very good question, and I have lots of thoughts about it. So when people come to me, which is often, as a psychologist, and say like, oh, I didn't, connect with this person, and I'll be the same. Maybe some people won't connect with me and they'll find someone else a better match. I will always say, give that person a go, and if it's not working, we know from research that the therapeutic alliance is one of the biggest predictors of outcome, regardless of what treatment is going to be used. So it's very, very important.
Which in layman's terms basically means if you get along, right? If you feel safe and seen with that person.
If you feel held with care, validated, listened, you can be trusting. So the therapeutic relationship is kind of, there's this bond, but you really feel that you're working on the same goals. That's really what the therapeutic alliance is about. So thank you for reminding me to use layman's terms. But it's really important. So we know that the therapy is important. So I'm talking about psychology here, like, we've got cognitive behaviour therapy or whatever it might be. But without that therapeutic alliance, and if it is low, if the therapeutic alliance is low, you actually might have poor outcomes. So it is very important. Now, in the case of my situation, I was in the middle of COVID. Psychiatrists had a long waiting list and I was not well. And it wasn't even something that really crossed my mind, to be honest with you. But in the end, I did find one who I gelled with beautifully, and he held me with care throughout my second pregnancy. And, it was a beautiful relationship, and I think that was really important. And again, I think that it's just a matter of me and that person didn't match well. So I'm sure he's great for some other people. But so in an ideal world, yes, you might try someone else, but at the same time, sometimes there's barriers that mean that that's not possible as well. So you might then have to go, okay, I'll find some other people around me who can support. So I might get a psychologist, I might get a GP and try and, make it work in that way. And some people also in the public sector may not feel that they have a choice as well.
Absolutely. And it kind of likens back to that idea of getting a team.
Yes.
When I was in rehab, I had a team. Like I had a psychiatrist, I had a psychologist, we had counsellors, we had the nursing team. Like it's so important to be able to have different people that you can take your stuff to. I really want to talk about that second pregnancy and how you grappled with getting to that decision. But before we jump ahead, can we talk about the transition from, and correct me if it's not the correct way of phrasing it, but the transition from postnatal depression to then psychosis, which I think is firstly incredibly misunderstood. So maybe we could spend a little time unpacking that. And then what was the physical manifestation of that illness within you?
Very good question, and it is very misunderstood. It's a really good question because it's something that I have tried to uncover through accessing my notes, because the truth is it's possible that I had psychosis very, very early on, especially given my extreme insomnia and my obsessionality with different thoughts, and then it just got worse. So my first psychiatrist, I accessed my notes in April, around when I was at that wedding that I said when my daughter was 6 months old. There's a note in there, anxiety versus psychosis, and he wasn't sure because it is sometimes very difficult to distinguish between the two, very severe anxiety and psychosis, because psychosis has a lot of different symptoms. So we've got what we call maybe, what are considered positive symptoms of psychosis are the things that people will notice, and this is consistent with postnatal psychosis or psychosis as it's seen in schizophrenia or other conditions. So those are what we call hallucinations. So they could be auditory, so what we hear, what we touch, what we smell, what we see, and other people don't see those things. So they're hallucinations, and they are probably the things that are more obvious. So if someone presents saying they're hearing voices, they're seeing things that aren't there, the psychosis diagnosis will often be a lot clearer. Then we've got delusions. So those are just basically what that means is beliefs that are not commonly held in the population. So they're not beliefs that are considered true or valid or realistic. So beyond, anxiety, it's more that the person's lost touch with some reality.
Can you give me an example of what that might look like?
Yep. So in motherhood in particular, often the psychosis, the theme is on motherhood. So for me, for example, I had what are called delusions of guilt. So I developed extreme guilt as a mother. I was this terrible mother because I put my daughter on a sleep routine when she was 6 weeks of age. Now, I became so obsessed with that, and that's what sort of became the thread that, over time I became so obsessed with. That's all I thought about, all I spoke about. Like I couldn't speak about anything else. So it's really around when you're looking at psychosis, it's how preoccupied is this person with this belief? Like, can they think of anything else? How distressed are they? Are they really distressed by this? And what's the conviction? So how much do they believe this is true? Like, is it 50% or is it like 90% this is true? Julia's life is completely ruined because she put her daughter on a sleep routine when she was 6 weeks old. She's not going to be able to return to be a mother, to be a psychologist, and her husband will leave her because of this decision. So it's not true. It's not reality. That's where I lost touch with reality. So I can clearly look at that now and be like, wow, like that doesn't make any sense. Like, I just found this one thread from my motherhood journey that became the cause of everything that had gone wrong. So that's often what happens in psychosis. Also for people with, I worked a lot with people with schizophrenia. Another example would be, what we call paranoid delusions. They're really commonly, I guess, spoken about in the media, but often not in a way that's, very helpful. So I've worked with people who might have beliefs that, for example, they're going to be harmed by, an organisation like the police or the CIA, and they're out to get them. And in reality, in their history, they may have actually been unsafe due to family violence. And so there's a thread from their past, something in their past that has become so big that they've lost touch with reality. So that's a couple of examples of delusions.
It's so interesting, isn't it? Because I feel like there is such a stigma around psychosis. Like if somebody were to say to me, what is psychosis? I would go straight to somebody who has done too many drugs, which has created some sort of schizophrenia, and now they're wandering the streets with voices telling them to kill people. Like that's kind of like what you see in the movies, or it's the worst case scenario, I suppose, which is often the ones that we see. So thank you for explaining that it can be so much more, I want to say subtle, but it's not subtle because it's soul destroying and can be incredibly harmful. But to realize that it's not necessarily, it's certainly not somebody's fault.
No.
And it can manifest in so many different ways.
Yes, there's also, those are the main symptoms I mentioned, but I want to mention also things like disrupted sleep and what we call thought disorder, which is basically where people aren't maybe speaking in a way that makes a lot of sense. But I wanted to just touch on what you said there because it's very important. It's such a common misconception that people with a psychotic disorder are violent, and it's because of the media. So we know that people with psychotic disorders are actually much more at risk of being a victim than a perpetrator of a crime. And actually the things, when we see them in the media, the things that make people more at risk of violence are actually gender, so being male, and being substance affected at the time rather than the psychosis itself. So there's a lot of misconceptions there, but unfortunately media reporting make it awful for people who have these conditions to speak publicly. And there's many people who are out there working, living, loving families, but they just don't choose to share that they have these conditions. I work with a number of people with psychotic disorders in my public role because we employ a lot of lived experience workers now as well. They're out there doing lots of different wonderful things.
That's amazing. And I think another misconception that I had was that once you receive a psychosis diagnosis, that you have it for life.
Some conditions are more ongoing, such as schizophrenia. Bipolar disorder type 1 sometimes has psychotic episodes as well. Schizoaffective disorder, there's other conditions, but they may have long periods of wellness or only one episode or occasional episodes, and they might be functioning very well between these more acute episodes. In postnatal psychosis though, it's very highly treatable, and if people seek treatment early, they are very likely to make a full recovery, but it's usually very urgent because it comes on very quickly, and they're of course in this vulnerable time looking after a new baby.
And do you think, how you just shared that often psychosis will just be a singular episode. Is there incidents that has to occur for it to be brought on? Why does it come? And why does it affect some people and not others?
So, the answer to the complex, because we've got postnatal psychosis, which is slightly different, and then the more enduring psychotic disorders. But the answer is that it's always multifactorial. We don't have one answer for any mental health condition coming on. In the past, unfortunately, psychosis was seen as really separate to other conditions such as depression and anxiety, as though it was all biological, but we know that's not the case from twin studies and from lots of research. There's other factors as well that contribute, such as trauma, so either recent trauma or childhood trauma, and those themes really commonly show up in the symptoms of psychosis. In the case of postpartum psychosis, again, there's many other different factors that contribute to it, but also for those women who have had, a lot of sleep deprivation and, traumatic experiences around their birth or pregnancy, that can also impact the way that the psychosis shows up.
And so having that understanding, were you fearful that this would happen again when you had your second child? And was there any consideration or conversation with your husband around those risk factors?
You know what? I shouldn't be smiling because I think a lot of women are very, very scared, understandably, when they've had a really severe mental health condition after their either their first pregnancy or another, then to have another child. I was abnormally relaxed. Some people might try to understand that in terms of, I don't know, so they might psychologically think I was dissociating from the event or moving through it. When I recovered, I made quite a dramatic recovery when I had electroconvulsive therapy. It was very quick, my recovery. Of course, I wasn't perfect after that. I had several sessions. But once I had that, the treatment that was effective for me, I made a very quick recovery and I felt so much better. So it was quite prompt after that. And then I was like, like almost like relieved that you know, all these unbearable symptoms I had been dealing with were, I was no longer experiencing them. My husband still finds it funny to think about the fact I came home from ECT one day on day leave from the hospital and I said, oh, thank God we can have another baby now. And he was like, yes.
Rocking back and
exactly. he was like, no. So I felt just so much better. And I also felt definitely that wouldn't have been the thing to do straight away. And I did need a lot more recovery. I needed to do some therapy to really understand my risk factors and how that had unfolded and how it had impacted me and my husband and my family and friends. But when I did go to have another child, which was about 18 months after the birth of my first, I fell pregnant, I had the team, I had the treatment, I had my psychologist there still, I had that psychiatrist who I saw, we had a plan, I felt very held with that, and I now knew that I could recover from that. So kind of like what you were saying before, Ash, like the first time you had depression, you think you can't recover from it, but now I knew I could, even though it was very severe, I felt that I could recover. So I was not, I felt quite good in that pregnancy.
Yeah, and I suppose as well, you knew what to look out for.
Yes.
You know, so if symptoms did start to arise, you could get onto them really, really quickly.
Yeah.
I didn't know that you'd had ECT. And if
Yes.
you don't mind, I'd love to talk about this a little bit more. I think that, again, there is a huge stigma around ECT. Can you explain what it actually is and how it works? Because, again, the movies, I swear, in my mind, I've got someone with electrodes hooked onto their brain and they're being like full on zapped, and it's quite terrifying. I remember my auntie having ECT when I was a teenager, and she came and lived with us while she was going through that process, and I was really scared because I didn't have the education and the knowledge. So perhaps could you enlighten us what is the truth around it?
Yeah, I'm happy to. I will put it out there. I'm not a psychiatrist, so I don't prescribe it and I don't provide it, but I can tell you based on what I know about it. I've been writing a little bit about it recently. So a lot of people have that view, that vision, I think especially from One Flew Over the Cuckoo's Nest with Jack Nicholson, where they held him down without any sedation and give him electroconvulsive therapy, which is not reality of how it is performed. So basically, you go into a medical sterile room and there will be an anaesthetist and they will put you to sleep for about 10 minutes and you will have look, I actually wasn't awake for mine, but you will have, a psychiatrist at the head bed, like the head area, and they put something on your head to induce a controlled seizure in the brain. They're very short, these seizures, and very controlled, so they can turn them on and turn them off, and it's all over in a matter of under a minute, and you'll go into the recovery and you'll wake up and that procedure will be over. So it's very, much not like that where people are being, they're asleep. I actually had witnessed it being done in when I was very early on as a psychologist in public mental health. I'd gone to, a few of my clients had it, and one of the psychiatrists was on duty that day and I wanted to see it done. And so that was my first introduction to electroconvulsive therapy, actually witnessing it being done and seeing that it was extremely calm, over in no time, and the clients were just moving through. And I also saw people benefiting from it as well. Oddly enough, for some reason, we decided to watch One Flew Over the Cuckoo's Nest when I was about 32 weeks pregnant with my second child. Oh, and I was like, it was New Year's Eve. My parents were there and we're all sitting there. I'm like, that's why people are nervous about it, because that's what they've got in their head from the anyway.
Totally.
Yeah.
Wow. So it's really not a violent procedure.
No, not at all. No.
And it rewires the brain, like without obviously not going, being that you've clearly stated you're not a psychiatrist, but help me understand like how it works.
So that's unfortunately one of the reasons it's so stigmatized. They actually don't fully know why it works.
You're kidding
Yeah,
me.
so it's been done for many, many years. I can't tell you exactly, a long, long time. But it was found out that it was effective for depression, and particularly people with what's called catatonic, where they can't really talk and move much, really severe depression. And it's been used, it's been changed over the years, so the seizures aren't as intense. But yes, they don't know exactly why it has its mechanism of action, and I think that's one of the reasons why. Having said that, it's similar with medication. We don't know a lot about the brain. You know, there's a belief and theories around how medication works, but there's not 100% certainty. So, but I think that probably contributes to the stigma around it.
Yeah, wow. Thank you for sharing. I feel like I'm learning so much on this episode today. Can we talk a little more now about the stigma that is put on medical professionals, whether that is perceived or it's reality, around we've got to keep our shit together because we're the ones that help people who don't have their shit together?
Yep.
Is that something that you experienced when you were going through your psychosis, your postnatal depression, thinking like, I can't get sick, I'm the one that's meant to help people?
Yes, there's absolutely. And I didn't expect it, or I mean, I suppose you don't really know till you're in something, do you? I am a staunch advocate against destigmatising things. I always have been with mental health, and people should talk about it. And I was so sad when I heard of clients who shared it with a friend or shared it with a workplace and that wasn't received well. But then when it happened to me, I was very concerned about being not necessarily struggling with a mental health condition in the first place, but being seen by anybody I knew who might know me, a colleague, or being seen in the street if I was in a nearby hospital. So I was very, very concerned about that. And I think it's because, similar to what you said, I mean, we're meant to know what to do. Like, shouldn't I be able to get the right diagnosis, know what the treatment should be? Shouldn't I be able to hold it together? Which of course is not true, because of course we're humans. We fit the statistics just like anybody else. But I think one of the things that contributes to that is that there's not a lot of communication in our workforce about this issue. There's not many people who speak publicly about it. As, you know, psychologists, as doctors, as whomever. And I think one of the reasons is also because of our registration in Australia, the regulating body is called APRA, the Australian Health Practitioner Regulation Agency. People are worried about being reported for struggling with their mental health. So people do get scared to go to their GP or go to a psychologist or go to a psychiatrist, even though you are absolutely able to seek treatment for your mental health. It's stated in there, and you can also provide effective care to people when you're struggling with your mental health. Now, when I was really severely unwell, I wouldn't have been practicing, and I wasn't practicing. I was on maternity leave. I hadn't been practicing. So, of course, that was an exception to the rule, but I'm not going to get reported because I'm not practicing. Having said that, my fears were almost realised when I was actually an inpatient, because one of the psychologists on the ward told my psychiatrist that she was going to report me to APRA for having my mental state at the time. He was surprised by this because I was not practicing. I was on maternity leave. I hadn't actually seen patients for nearly 10 months by that point. I'd been off, the whole time. And but he said, just seek supervision, go to a more senior psychologist. But he felt he had to tell me. And I was very upset about it.
How distressing.
It really was, because I was in the middle of ECT treatment. I knew on the one hand that I wasn't doing anything wrong by being mentally unwell, but I also was very fearful. Like, if they get a report, they've got to investigate it. They're going to then do this whole investigation. Is it going to be on my record? And she did go and seek guidance, and she looked at the reporting requirements and found out that, of course, she didn't need to report me. I wasn't practicing. But yeah, I guess I want to say also, for people who are just managing ongoing conditions, they are absolutely able to work. They're doing the right thing. They're looking after their mental health, and that's, respected, and you're absolutely able to seek help.
It's so funny, isn't it? Like, it just makes me think about, I'm very public and open about the fact that I'm a recovering alcoholic. And I know, many of my friends who are also recovering alcoholics who have been sober for 5, 6, 7 decades of time. And yet there are still certain industries where if you disclose that you're in recovery, it'll be a massive mark against your name. They're like, we don't want to, and look, I get it from an organisation standpoint, the risk, I suppose, of taking somebody in who's disclosed that they've had a problem in the past with drugs or alcohol. What if they were to relapse? What would the implications of that be? However, I stand to say that of those people who are incredibly well, who haven't consumed alcohol for, maybe 5, 6, 7 years, who are often in therapy, who are doing the work. They're actually really well-rounded, incredible people who contribute to society and often make the best employees.
Absolutely. Yes.
Rather than old mate who's drinking a six-pack every night and coming in slightly hungover and doing a, 50% job.
And I think that what you say, like actually being honest about it, like they're kind of, you're kind of putting it out there, you're committed to working on it, and rather than just keeping it secret and then people don't know how to support you through that. So you're actually more at risk. It's such a shame when people don't feel in certain industries that they can be honest. I guess that was one of my reasons for speaking, is because I did R and, I've had psychologists say to me, are you sure you don't want to use an alias when you write about it, because, your clients will be able to see this about you. And I'm I've thought about it. I thought about it a lot in my own supervision, and I thought, no, it was worthwhile because if other health practitioners can realise that they can talk about their struggles, that's a great thing. I think it's a very important.
Yeah, absolutely. And tell me, you just mentioned that you are writing.
Yes.
You're writing a memoir with your husband.
Yep.
Let's talk about your husband for a moment, and then I want to talk about the book.
Yep.
What was his experience through all of this? I can imagine it would have been really difficult to watch the person that you love so dearly struggle in this way and perhaps feel hopeless in your own right of not being able to help. Have you guys you're writing a book together, so I imagine you've spoken about it. What was it like for him?
Very, very difficult. I have always said and stand by, I think it was worse for him because I wasn't myself. It was, don't get me wrong, it was bad what happened to me. But as I said, I felt very much, once I felt better, I was like, oh, like that really wasn't me.
It's like you're waking up. You're like,
yes.
oh, that was a terrible dream.
Yeah, because he was very much himself throughout the whole thing, watching it and trying to get, treatments that then didn't help or, different things happening. So he's watching and hoping. And he's also in the middle of COVID. His family's overseas. My family's mostly interstate. He's got a full-time job, a baby and a very sick wife. So he really struggled with his mental health in particular once I got better. It was almost like he could
fall
completely apart.
Yes, of course.
So he did end up having therapy. It also affected us, in particular. I think we just had to take time to reconnect as a little family unit and feel safe. It was a long time until we not that we told friends, and I was very happy once I was recovered to talk to people about it, but we didn't go sharing more publicly, I guess, until nearly 5 years after the birth of our first child, because I didn't struggle at all with my mental health after the second one, which was very fortunate.
Yeah, I didn't even think about that. The fact that, in a lot of instances, you'll go and talk to your friends about it, but it's such a private matter what you were going through and something that you weren't sharing yet. So it's almost like he then also, unless obviously it's with a therapist, it would be really hard for him to be able to just go, well, firstly, we were in COVID, so you couldn't go anywhere, but to just be able to really have somebody to talk to.
Yes, he's probably not the one to go and seek as much as I do. I'm very much a talker with all my friends and accessing that, whereas he's a bit more introverted, so keeps things more to himself, and probably also was just in survival mode, getting through it, making sure I got care, that our daughter was looked after, and which he did a great job of. But yeah, it was very, very difficult for him. I think the book is probably part of our healing together and coming together and thinking, what could we do from the experience, and also it's led to lots of discussions and also sometimes different perspectives about things, which is also interesting.
Yeah, and so without giving out too much away, because we want people to buy the book once it comes out, what are some of the learnings that you've taken away, or some of the ways that you guys have healed that relationship?
Yeah. I'm trying to think. I think one of the main motivating factors for the book was to kind of highlight how an informed couple with lots of knowledge and access could fall so deeply into despair over a period of 8 months, where treatment after treatment didn't go well. There were probably areas in my care where communication could have been much better between practitioners, hospitals, and there were lots of missed opportunities and I just kept getting worse. So I think that was one of the main things to highlight those things. In terms of our healing, I would say the biggest thing was being able to talk about it again properly, because he was very fearful that once I got better, that if he reminded me of anything, that he would trigger me back into some kind of psychosis or distress, which was not true. But having said that, I wasn't as strong as I am now then, in that recovery period, trying to make sense of it all. I wanted to talk about it, but he really struggled. So once he'd done his therapy, which was probably more when my other daughter when I was pregnant with my second daughter, he did that therapy, and I think that helped him to understand his own distress and his own reactions and nightmares, and him actually being able to come and tell me exactly how he was suffering from what we had been through really helped us to heal together, because him keeping it to himself to try and protect me was not helping me to kind of really understand what he was going through and why he hadn't changed, but he certainly wasn't fully himself afterwards. He was, more hypervigilant. He was not as a bit different to me in my second pregnancy. So all those things just we could heal once we could actually talk about it in full and not have these secrets where Julia can't know because she might get sick again. Because now I know everything. I've got my notes. I've got 3 messages. I've got the book. So, I mean, there's probably still things I can't remember. That's okay. I remember a lot. I think he's been surprised. He thought, because with electroconvulsive therapy, I guess for some people, memory loss is a challenge, especially short term. And I think that's, so people need to really be consented with their doctors, because some people are distressed by the symptoms. I only had brief short-term memory loss. I didn't have, any long-term memory loss. And I remember a lot of the things that we went through. But he was kind of surprised by that. So he was almost trying to protect me from stuff that he thought I couldn't remember, but I actually did. So healing conversations and being open and honest, and because it's only fair for me to know how it affected him.
Yeah, and it allows it enables the two of you to draw closer.
Yes.
Because when things are unspoken, it creates a distance.
Yes, absolutely.
It may not be physical. You may both still be present in the house, but when you're not able to share open from a place of vulnerability without any fear, it does. It just draws you further and further apart. So I love that you've been able to come together and just lay it all out. And in a way, not without the fear of how it's going to affect, like trusting that you guys can get through that and not being so worried about how it's going to impact the other person. I mean, for me, I often find, in the past I would never say how I really felt because I was so afraid of upsetting the other person, or are they going to be okay? But I've realized now over time that I'm actually doing a disservice to the relationship if I hold back, if I continue that people-pleasing behavior of, I'm just going to say what people need me to say to make sure everyone's okay. Like that's like little Ash there that learned how to do that. So important to just be able to, with compassion and with kindness, but to really just be truthful in that.
I 100% agree. And I think you need to have that openness and on it, because otherwise you withhold and you're not yourself. You're not your full emotional self and how you're doing. And for us, it was very unusual because we've been together a long time. Not that means you've got good communication, but we've been together since 2007. We know each other very, very well before we had kids. We've always been very open. We've been through lots of different things together like any couple. So for that to be sort of this secret, and in fact, my husband told my close friends who knew what had been gone through to also not talk about the episode with me because of this fear. And I also understand it. I also understand why he did that when I was not so well, but when I was, the problem was when I was ready to talk about it, I'd sort of talk to my friends like, hey, like that was crazy when that happened. They're like, oh, hey, it's warm today. And and I was kind of like, oh, this is weird. And I didn't really know that he'd told them that. So now they feel that they can speak about this with me because it's, it's been a few years, and also that we're writing a book. But he now realises that it's okay too. He just wanted to give distance, but perhaps by giving distance, it led to impacts for him and then for our communication.
Yeah, of course, of course. So, Julia, for somebody who's been listening along today and they are struggling with their mental health, whether that be, something that we've touched on today or maybe it's something that we haven't covered, it can be a little overwhelming to know what to do with that.
Yes.
Firstly, to even acknowledge that maybe I'm not okay and it's okay not to be okay. But what advice would you have for somebody by way of seeking out help? Like, what's the process? What's the recommendation, and why is it so important?
Very good questions. I think it's so important because when we hold our struggles to ourselves, as we were saying, you're not usually able to help yourself in a moment of distress. Like when we've got, really mild levels of distress, we're like, oh, I'm a bit anxious, I can go for a walk, I can do some breathing. But if it's getting, really distressing, we often can't see ourselves and we need somebody else, that team around us. So often, I think about our GP is often a great first person to go to because they will be able to do an assessment and see, do you need a psychologist, a psychiatrist, who can I refer you to? But if you can't see your GP or you want to speak to somebody over the phone, which is often a really good port of call, particularly, if it's for new or expecting parents, Panda has a helpline, which I know you'll share that number. There's also Lifeline, which is 24/7 if you're really in a state of acute distress. And I think it's just because if you're really distressed, your mind is often not reliable. You can develop tunnel vision. You can't see, different ways out of your situation. So that's when you need somebody to help you. So those are some places I would go. There's many more, but sometimes I think if I give too many, to go through
it's
one,
overwhelming.
Go to one, and then they will help you find what you need.
And I remember that during COVID there was. And this is, I can't say this was my personal experience, but I've had other people tell me it was, impossible to get in to see a psychologist because of the demand. What does it look like now? What's the current climate out there?
It's a very good question. My opinion, which may not be reality, I often see in the media that we've got not enough psychologists. I know many practices, if you called, you'd get an appointment within the next month. So I don't think it's impossible. If you call a practice and they say they've got a wait list of a long time, call another one. There absolutely are spots. It's definitely not like it was. When I started in private practice at the end of 2021, there was huge wait lists, months and months because of COVID, absolutely. But it has shifted. With psychiatrists, they are in much. There's a lot less of them for what we need, so we definitely need more people to train as psychiatrists. So I can't speak to the wait list there, but there are often big wait lists. But I think you just see your GP if you need to be seen urgently. You'll be seen urgently in the public sector where there are psychiatrists rostered on every day.
Yeah, fantastic. Thank you for sharing that. And I will link those recommendations in the episode show notes if anybody does want to reach out for a little more support. Julia, we have a closing question that I ask every guest. And it's really about how you now live your life today as this version of yourself that's stepped out from behind the smile. So my question for you is, what are your 3 non-negotiables that allow you to live your life today happy, joyful and free?
3 non-negotiables. That's a good question. Laughing every day about something. Could be a random meme, anything.
I love it. Those memes, you've got those friends, right, where they just get like 10 memes a day.
Yeah.
Or I have friends who send me memes and I'm like, how am I meant to check all of these? But yes, we love our friends who send memes.
Any meme, just laugh about something, even if you're struggling. I have found I can usually still find one thing to laugh about. Doing as best as I can to be present. Now, we can't be present all the time, but I think if it's a moment, in particular with my kids, they are able to be incredibly present without much effort. So watching them, being present with them, or, what I did earlier today, going down to the beach. I find the beach an incredible place to be present, just wind, smells, all the grounding. And the third one is connecting with the people I love. I've got to have a conversation with a bestie, with my husband, with a colleague. I love connection, and without connection, I can't be happy.
I love that. That's beautiful. They're really, really laughter, connection and grounding.
Yep.
Yeah, beautiful. I completely agree. Thank you so much. Thank you so much for being here. I know that a lot of people will have gotten a lot of value out of the conversation today. If people want to reach out, find out, more about when the book is coming out, all that kind of information, where is the best place for them to go?
So Instagram, I am still learning how to use it well, but please come along for the ride while I do that. At Dr. Julia Nicolls, and I've got a website also, which is drjulianicolls.com.
Amazing. I'll make sure I pop that in the episode show notes as well. I love it. I'm learning how to use Instagram. Aren't we all? I tell you what. I am, again, just so grateful that you have come here today. We say here on Behind the Smile that when we recover loudly, no one needs suffer in silence. So thank you so much for your honesty, your vulnerability and your time.
Thank you for having me, Ash.
Such a pleasure.